Hello, my name is Tatag and I'm from D3 Pharmacy Polteka Mangunwijaya study program. My student number is 222025. And now I will give my opinion about case 15. I think that the physicians should not responsible for LDK's treatment force her to undergo chemotherapy, including blood transfusions, because although LDK is a minor, she is a mature for her age and is capable of understanding the consequences of the recommended treatment, which not only contradicts her beliefs but is also aggressive and painful. Therefore, the course of treatment should be the one suggested by her and her family, even though its therapeutic value is unclear. The court decisions also said that the treatment proposed by the hospital addressed the physical disease only. It failed to address the patient's emotional needs and her religious beliefs. The emotional trauma she would experience as a result of any attempt of transfusion could have nothing but a negative effect on any treatment being undertaken. LDK should be given the opportunity to fight this disease with dignity and peace of mind. That can only be achieved by accepting the plan put forward by her and her parents, despite the lack of statistics regarding the rate of success with the mega vitamin treatment. This treatment is still preferable. During this treatment, LDK will be surrounded by her family and she will be free to communicate with her God. She will have peace of mind and can continue attempting to overcome this dreadful disease with dignity. Respecting cultural diversity is an integral part of human rights, though we accept the axiom that every human being has the right to dignity and the right to life. We must also respect his choice to live in certain way and to hold certain beliefs. The right to refuse medical, albeit life-saving, treatment due to religious and cultural beliefs is part of a person's dignity, and we should respect his choice since we respect him as a human being with dignity and free mind. We use human rights to set global norms. However, there is perception that since these norms grew from historical and social circumstances, they are not relevant to societies and people who have different beliefs or cultures. A possible answer that claim is that although human rights have roots in certain culture, they still have sufficient flexibility to suit cultural diversity. We accept refusal to life-saving treatment in respecting a person's autonomy. A person's refusal to treatment will taking personal responsibility for the outcome is an expression of his dignity as human being. The medical staff cannot replace the patient's inner feelings by their own considerations when it relates to a minor who is legally incompetent and cannot refuse or consent to treatment, but on the other hand does understand the situations and its consequences. His wishes must be considered and he must be involved as much as possible. In the decisions, this issue is addressed in Article 7A of the Universal Declaration on Bioethics and Human Rights, and the various health-related international instruments and conventions such in Article 12 of the Convention on the Rights of the Child. The more mature the adolescent and the deeper his capability to understand, the more conscious we must be to respect his dignity and wishes. When the child has beliefs which do not correspond with our own, or when he lives within a different culture, we ought to be flexible and consider his will as well. The need to balance between the fact the patient is minor and that he has full understanding of the situation and is mentally competent obligates the medical team to consider the local regulations on the one hand, but also to pay attention to the minor's needs on the other. That's my opinion. Thank you.